Uh, so once we get the results, right? I just went through the general process of hypothesis testing. Um, we have two types of errors if we're gonna draw a conclusion based on the p-value and test statistic. We're gonna sometimes make a type 1 error that is about the size, okay, of the test. The type 1 error is made when we reject the null hypothesis when it is true. Assuming that, the null hypothesis is that, the observed test statistic is purely due to some chance variation or there's no association going on. Okay? That is the noun. Then basically this type of error says, well, when there is no association going on and we reject the noun, we think that there's some association going on. Okay? Then we make type 1 error. We can also make type 2 error here. It is called the power error test. It is to accept noun when it is false. So this is a little bit, kind of mind-boggling without giving you examples. But I'll go over examples later on. So let's say the null hypothesis is that beta k is 0. We can either accept now or reject now, right? That's on our side. But in reality, there are two possibilities, right? Either, in fact, beta is 0, okay? And we accept now, the now is beta k 0. So the reality concurs with the null hypothesis, then we're not making error, right? Well, another scenario is, let's say, in fact, beta is not equal to 0. There is some association going on between a covariate and response variable, and we reject the noun because the noun is beta is 0. There's no association going on. So we reject it. That means we think there's something going on. Okay, then we're not making error. Okay, but when do we make errors? So we have type 1 error here. We have type 2 error here. So type 1 error is made when we reject the true noun. It's called true noun. So the noun is true. So there's no association going on, but we think there is some association going on. Sometimes in clinical research, it's called what? False positive. It is wrong. We think, there's something going on, but it turns out that, there's nothing going on. And that mistake, the probability of making that mistake is called alpha. Okay, here somehow it's truncated. Well, we can also make type 2 errors. Okay, type 2 errors are made when, in fact, in this case, beta is not 0. That is, there's something going on. Okay, but we accept it now. We think there's nothing going on. Huh? That's called accept the false. That's called false negative. We think there's nothing going on, but turns out there is something going on. And that probability is called beta. Okay, and beta. Okay, and beta is related to the power of hypothesis testing. Right? So give you some concrete examples to show you why these types of errors are important. Sometimes, it's okay to have large type 1 error. And sometimes it's probably not okay to have type 1 error. And bear that in your mind that when we increase the probability of making type 1 error, the probability of making type 2 error also decreases. So there's a trade-off between these two. Between these two, Otherwise, things are gonna become simpler. We can try our best to suppress the two, right? Because we want to make errors as fewer as possible, as little as possible, right? But here, according to statistical theory and empirical evidence, that when we make when the probability of making one type of error smaller, the other type gonna increase. So just to review here, so type 1 error is about the size of the test, and it is about making false positive error, right? False positive error. So there's nothing going on, but we think there's something going on. And type 2 error, it is about the power of a hypothesis test. And it is about false negative, okay? False negative. That is, we think there's nothing going on, but it turns out that there is effect, there is association, but we reject it, okay? So here, I'm going to show you two examples. First is in our penal system or legal system. That's a conviction of criminals, okay? And the punishment is very severe. Let's say, if a suspect is convicted, then that suspect is going to receive capital punishment. So the hypotheses here, now let's say for the jury or for, let's say, legal counselors or for the judge, right? The suspect, let's say, committed crime. That's the hypotheses, okay? And that is the alternative hypothesis. And a non-hypothesis, in such cases, is usually the suspect didn't commit the crime. Okay, so it was assumed innocence of the suspects, right? That's pretty reasonable. Okay, so what does it mean to have type 1 error? It means the suspect did commit the crime, but was found guilty, right? It's called false positive. False positive. And what is to make type 2 error? Okay, it means the suspect committed the crime, but was acquitted. Okay, let's say this is just a petty crime. Okay, petty crime. So, in this case, we want to have a small, very small type 1 error. The reason is because, let's say for petty crime, shoplifting, or things along that line, embezzlement, okay? If we make a mistake, then what's going to happen to this convicted, wrongfully convicted suspect? It's capital punishment. The punishment is too severe. So here we have to factor into, ethical concerns into our consideration, right? For kind of non-violent crime sometimes, and if the consequence is not that severe, and if the conviction going to lead to very severe punishment, penalty, then we want to have a very, very small type 1 error. Of course, here I, working a little bit exaggeration, but we do have cases like that. So in this case, actually, we want to have very small type 1 error. At the same time, the balance is going to tilt towards what? Type 2 error. The probability is going to increase. So yeah, it's possible. Actually, the probability for that suspect commit the crime but was acquitted increases. But we have weighed the cost and benefit. The cost is that the suspect is going to receive capital punishment. He's going to die. But the other side of the story is, possibly that suspect didn't commit the crime. Committed crime, but was not penalized. So to weigh the cost and benefit, and if we take a very humanitarian approach, probably, we'd prefer to make a, type 2 error than type 1 error. Okay, so that's one scenario. Another scenario. Again, I want to brush up your memory about what is type 1 error, what is type 2 error. So here's a bit of convoluted. And if you're not very familiar with this, setup, then you might want pause the video and think through. Okay, so for type 1 error, again, it means false positive. That is, there is nothing going on, but we think there's something going on. There's association, okay, or there is effect. Type 2 error, excuse me, is false negative. That is, there is something going on, but we negate that association, making an error. So in medicine, for example, mammogram screening and testing, right? For ladies go to their annual checkup. Sometimes after the age of 40, they have to do annual checkup using mammogram, right, to screen for breast cancer. And there are two possible screening procedures. One is just a very inexpensive screening procedure. That's a blood test, assuming there is a one, okay, inexpensive one. And there is a very formal testing. Let's say MRI or biopsy. Okay, so for mammogram screening, right? Blood test, it is very inexpensive, but has high false positive. That is, it is very likely that you don't have breast cancer, but there's no hump, but there's nothing going on. But the test tends to produce false positive. Kind of suspecting that there's something going on with the patient, with health client. And another test is what doctors call testing. So very formal testing using, let's say, MRI and biopsy. These testing procedures are more accurate, but expensive. So what doctors usually do, they're gonna screening, right? And if the results of those screening tests turn out to be positive, then they're going to use second procedure, testing, right? Testing. So that's common procedure. So the hypothesis here for doctors is that the patient has breast cancer, so that is alternative, right? And the non-hypothesis is the patient is free of breast cancer. That is, there's nothing going on. Nothing going on. Okay. So what is type 1 error? Type 1 error occurs when the patient has no cancer, but is suspected of having it, right? Using testing procedure, okay? So what is type 2 error? Type 2 error is made when the patient has cancer, but is diagnosed as cancer-free. So which one, patients prefer to have? Hopefully, same for the doctor. Well, probably, type 1, right? And probably, the patients want to have a very small type 2 error, right? So the patient has cancer, but is diagnosed as cancer-free, right? And it is okay to have large, a big probability of type 1 error, right? It's okay because, if, the patient is suspected of having cancer, a wrong diagnosis, then the doctor gonna prescribe to have further testing, right? MRI or biopsy, okay? So this is a scenario when we wanna have very small type 2 error and having a large type 1 error is not a major issue. So see the application of type 1 error or type 2 errors. Okay,